everyone. Welcome back to the Blueberry Pediatrics Podcast. Today I am with Dr. Shazma Mithani, who is an emergency room doc, but also a celebrity, let's say, on social media. And today we're going to be chatting about responding to emergency situations in your child's life, choking, swimming, and more. Welcome to the show. We're so excited that you're here.
Thanks for having me today.
Yeah. All right. So, first of all, what inspired you to start making educational videos about health issues that are commonly seen in the emergency room?
A lot of it was because of what I was seeing in the emergency room kind of during the pandemic and certainly post-pandemic because of the significant increase in volumes that we were seeing. I started to, I think, become more acutely aware. Like in the ER, there are emergencies, and then there are non-emergencies that could
Yeah.
be better suited to like primary care or urgent care. And so there's always a mix of those things. And I would say that just as the volumes and pressures increased, I became a lot more aware of the things that maybe didn't need to take emergency medicine care and space because there was still like not enough capacity for the people who truly needed the emergency department. And so part of that was, I think, related to just the health literacy of the general population. And so I decided, why not use the education that I have, the knowledge that I have, to try to get some more information out to the general public to help just inform them and give them the knowledge to help decide, should I take my child into the ER? Should I wait to see my primary care provider? Should I go to an urgent care? Or is it something that I can even manage at home?
Yeah, absolutely. My ER days from training are like long behind me. I've been in primary care for a long time, but I'm sure that other docs at Blueberry Pediatrics are like singing the praises of what you're saying right now as I listen to this, because it's so true. We see so many things that we're like, oh, you don't have to go to the ER for that. It's okay. We can take care of that for you, and it'll be less wait time, less time where you're maybe exposed to more severe illnesses.
Mm-hmm.
And it's so much better, of course, for you all as emergency room physicians and providers, because then you can really focus on what needs to be there and make sure you have that capacity. So tell me, what are some of the most common pediatric emergency room visits that you see? And let's include some of those things that are true emergencies, but then also like just volume wise, what comes in to see you, whether it needs to be there or not.
Yeah, so I mean, when it comes to true emergencies, typically traumatic injuries, especially in the summer,
Mhm.
lots more traumatic injuries because people are out and about and doing things, right? Whether it's bicycling, scooters, falls, motor vehicle collisions, lots of traumatic injuries are often kind of the things that need emergencies. Of course, patients who have chronic medical conditions, with lots of kind of potential chromosomal issues or other developmental issues, like these are patients that often need emergency services quite frequently
Mhm.
because of their underlying medical conditions. And those are true emergencies. Things like anaphylaxis or allergies um kind of come to mind as well. And then when we talk more about, and like those, thankfully in pediatrics, I work in adults as well, but in pediatrics, like the higher acuity, higher emergency things thankfully tend to be a lower proportion of the volume of things that we see in the ER. When it comes to kind of the less emergent things or the higher volume things, I mean, some of it is seasonal, but there's always that underlying flavor of like the viral illnesses, right? So whether
Totally.
it's respiratory, especially kind of in the fall and into the winter, but we're still seeing it throughout the summer, whether it's, a GI bug that's coming through, like vomiting and diarrhea, um, fever just in general, rashes, things like that. So like the, less urgent things that are more common, these are often things that I'm seeing in the ER as well.
Yeah.
Fever is a really common one. Fevers are very scary for parents.
Mhm.
And there's a lot of kind of misconceptions and misinformation about fevers out there. And so a lot of parents come in quite worried about that when their child has a fever.
Yeah, totally. And to your point about health literacy, I mean, I'm always still surprised by what people, when they call in and I say, you don't have to go to the ER for that, or you need to go to the ER for that,
Hmm.
how shocked parents are. It's
Yeah.
really interesting. And the other thing you mentioned about the fevers, I remember one of my mentors in medical school, Dr. Lewis First, who is the editor of Pediatrics, the Journal of Pediatrics. he used to always say, like, fever is your friend.
Hmm.
Generally speaking, fever is just your body helping to fight that infection. But man, I can attest, as a parent myself, that when your kid has a fever, even I had to stop and like get my doctor brain on and remind myself that we are not having an emergency, that it's all going to be okay. So, totally, you're right. I mean, natural response to be fearful, I think, when your kid is acting unwell. Um, when you see a lot of kids come in, I'm sure it's the same for when I was in private practice for a long time, where a lot of parents will say, I didn't treat the fever because I wanted you to see my kiddo as sick as possible. And I know what my response is to that, but I would love to hear what you have to say about that as well.
So my response is I always say the same thing to parents. If your child looks great and they're running around and having a great time and they happen to have a temperature that's a fever, don't treat it. I mean,
Yep.
as you kind of said, the general understanding is that a fever is a positive thing, that it is, a part of the body's response to fighting off an infection. And it has positive benefits. But of course, the flip side of that is if your child is clingy, not wanting to drink anything, clearly looks uncomfortable, is shivering, doesn't look like they're having a good time, please treat the fever. We will believe you when you come in and say your child has a fever. We will. And so we certainly never want a child to be uncomfortable with the symptoms. And it's hard, I think, for us as adults to remember that, because in adults, we don't get fevers very often. And so you forget how crummy it feels
Yeah.
when you do have a fever. And we certainly don't want any child to have that discomfort either. So if your child has a fever and they look like they're uncomfortable, please treat them.
Yeah, absolutely. And I would say too, for me, when I'm seeing patients, sometimes actually having a treated fever is helpful, because then you can see kind of what can be attributed to the fever and what is actually what's going on. Because if a
Mhm.
kid has medications that are antipyretics or anti-fever medications on board, and then they calm down, they look pretty good, they're looking what we call like non-toxic in your world and my world,
Mhm.
then I'm a lot more reassured, and I still believe you. You still believe them, I'm sure.
Yes.
But it helps you also as a physician to kind of put your hat on of like, ooh, okay, this is super dangerous, or this is, I think, going to be okay. It's a piece of
Mhm.
data that can help us.
Yeah, exactly. And then we get to see their vital signs normalize when their fever comes down as well. And like that is also really helpful to see.
Yeah. Okay. So, what is different about when kids are in the pediatric ER? If people in their communities have a pediatric ER versus a mixed ER where it's adults and kids, what do you see that's different in the pediatric world versus adult world? And then also, because you work in both, if people have an option for going to a more specialized pediatric ER versus a kind of more comprehensive ER that treats adults and kids and teens, what's your recommendation for that?
Yeah. So in terms of, like, to answer your first question, in terms of the difference, I mean, I work in both. I work in kind of a mostly adult ER where pediatric patients also do come in. And then I work in a solely pediatric emergency
Mhm.
department. And I would say in my experience, the difference, I mean, part of it, a lot of it is just the comfort level of the healthcare workers, right?
Yeah.
And so for us in a pediatric ER, we are seeing a wide gamut of like sick and non-sick patients. So we have a very good sense of who needs emergent management and who can wait a little longer, or who looks good, who can go home. And that's simply just because of the volume that we see there.
Mhm.
Whereas in, a mixed ER or a more adult or a community emergency department that sees a mix of wide ranges of patient ages, kids can be scary. And I certainly understand that. I get phone calls from, we take phone calls from community centers and more rural centers where um, it's scary to have a kid in front of them that, has a fever,
Yeah.
or maybe it's even just had a febrile seizure, which for us in a pediatric emerge, we see all the time. And we know that it's okay.
Yep.
Whereas if it's something that you see less frequently, there's definitely that comfort level, I think, is different. I don't think the access to management, I think, is fairly similar between the two
Yeah.
for run of the mill kind of bread and butter stuff, right? Because whether it's, what the physician or healthcare worker seeing in front of them, or whether it's being able to call for help on a phone and like having a pediatrician take the phone call, like that access to care is still there. And then in terms of like what type of site to choose, I mean, if you think it's truly an emergency, like go to your closest center,
Yep.
and then they can always refer you out or send you out or ask for help or call for help as needed. If it's something that you think could, if your child looks okay and they need a bit more time. In general, I would say if they have like an underlying complex medical history where they already have kind of specialists and pediatric subspecialists at a specific hospital, probably makes sense to go to that hospital so you can get that kind of more comprehensive multidisciplinary care if it's a child that has more complex issues. If it's, you're worried about a fever or something that's a bit more kind of common or run of the mill, I would say, yeah, just go to your most convenient or nearest ER or urgent care. Or if you can get into see your primary care provider, it's always reasonable to see them too.
Yeah, absolutely. I remember tons of kids that we would see. I went to Stanford for my residency, and tons of kids you would see who, like, we knew them in the emergency room because they would come through because that was kind of their home. We knew all the specialists, they knew the specialists. So I agree. If it's in that certain scenario, but otherwise, don't skip getting care and not go somewhere just because it's not a pediatric ER.
Exactly.
So tell me about some of the misconceptions that you see in terms of health literacy or in terms of understanding that you try to clear up when you're
Yeah, so fever is a big one. We kind of have touched on that a little bit, but there's a lot of concerns come in with, oh, well, if a fever is a certain height, that means something. So, if a child has a high fever, it means that they're sicker, or it means that they have like a bacterial versus a viral infection, which is not true. Of course, we know that. There's certainly concerns that a high fever can cause a febrile seizure. And again, we know that that's not the case too, just from the evidence and data that we have. And so those are common concerns about fevers. Often other things, when it comes to, we can get into vaccines if we want to. There's a lot of myths and misconceptions about vaccines, unfortunately, that we're still dealing with from the time of Andrew Wakefield, unfortunately, right? Where that ghost still lives on, we'll say, of like just having that misinformation perpetuated and unfortunately lead to vaccine hesitancy in parents. And then seeing a rise in like vaccine preventable illnesses that keep coming in waves too. So like that's another thing that I'm starting to see more and more often, I would say.
Yeah, absolutely. I would say especially kind of post-pandemic, post-COVID, right? That I think like the tide changed a little bit more. We saw that kind of coming up more. And absolutely. So many things we can't prevent with our kids. Like, that's just like, it's going to happen or it could happen. So I'm always encouraging parents, hey, if there are things like vaccine preventable illnesses that we can address, that just takes some things off the list and makes it also so a lot of times we can do less poking and prodding and looking and, digging at your kid because we can say that, okay, those things are significantly less likely for your child.
Exactly.
Let's talk about prevention in other ways, because you talked, of course, about the fact that kids come in with injuries. They come in with things like falls, swimming stuff, all of that. My youngest daughter, the one time she went to the ER, it was because she stuck a Lego a coin up her nose, and I tried with the Afrin to get it out myself, and I could not, and the angel kiss and whatnot on her nose. But there's lots of things that can be prevented. So talk to me about that. What are some things that you really wish people would take to heart or take seriously when it comes to preventing issues for their kids?
Yeah, helmets are a big one. And so I think that there is a lot of people think like helmets only go with bicycles, but helmets really should go with any sort of wheeled object at all, right? Like if it's a scooter, like a push scooter, a bicycle, I would say even with like snow sports. So like my kids, like our family skis, always helmets on, right? Yeah. Tobogganing, which is another, or like sledding, another thing that people don't really think about for helmets, but like you're going pretty fast down a hill. You hit an icy patch and then the kid can fly off and hit their head on a rock or something, right? So even like things like sledding, horseback riding, right? So there are like lots of activities that require helmets from a safety perspective. So helmets are a big one. For me, like as someone who works in a pediatric ER and the injuries that I see, like trampoline safety. Yeah. So in particular, like a rule in our family is that we don't do trampoline parks because I have just seen way, way too many injuries of young kids coming through there, whether it's broken bones or concussions or even worse, like spinal cord injuries. Like I've seen a broad range of injuries there. Things like ATVs or like all-terrain vehicles, right? Like lots and lots of injuries there where there are young kids that, you go up a hill, even if you're going up slowly, momentum can kind of push you sideways and the kids can get pinned under these and have quite severe injuries, right? And so things like that. And then of course, like seatbelts and car seats, right? So like being
Mhm.
very comfortable or not even comfortable, like really knowing like what is the weight limit and the height limit before you can advance to the next thing. Um, because a lot of people think it's based on age, but it's really not. Like it's based on what you're like the upper limit of height. And then really it's weight based in terms of how you can graduate through the car seat system, we'll call it. And so for me, my approach is, and my husband kind of rolls his eyes at me and I'm like, well, until they actually outgrow it, I don't want them to go to the next one. Like it's not just
Mhm.
because they happen to meet the minimum requirements of a booster seat. It's like, have they actually outgrown a 5-point restraint and like kind of are beyond the thresholds for that, where it's not safe for them to be in that anymore before I move them on to the next thing. Cause yeah, I mean, again, from an injury standpoint, the number of severe injuries I've seen from motor vehicle collisions of where the the adults in the vehicle that are wearing seatbelts are severely injured and their properly car seated infant or toddler have a couple of scratches because the car seat was installed safely and they were in the right car seat.
Yeah, absolutely. We could do a whole episode on
Hmm.
non-physician partners and what they think about our pediatric recommendations and how safe we are. I know there's a whole, I mean, like sleepovers, like
Oh
people,
yeah.
I mean, like I'm
Yep.
like, no, 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 no.
Yeah. Yeah.
100%. Okay. And then what about swimming? Talk to me about, I know
Hmm.
we're getting now, further into, we're about to be in the fall, like it's back to school, so we'll have less swimming, but a lot of places around the country, there's year-long swimming, or people
Hmm.
have access to pools at their homes or at friends' homes. So talk to me about like your number one tip for that.
Oh my goodness. Like just never trust a kid. Honestly,
Yes.
that's like my number one tip. Like I don't care how old they are or how strong of a swimmer they are. It's like there's always a PFD, like a personal flotation device, a life jacket
Mhm.
on my kids, and they always have to be supervised. And especially if they're like learning to swim and like starting to take that life jacket off, someone in the pool within arm's reach of them all the time.
Mhm.
Because I'm like, it takes, I mean, we hear this and say this all the time. It takes a second, like where you turn around, you get distracted, you're talking to someone, and then your little child who you can barely see over the edge of the pool. Or if they're in an open body of water and they've kind of, even in a shallow one, they've kind of laid down and you can't see them anymore. Like it really doesn't take much. And it is entirely preventable. Drowning is entirely preventable in these
Mhm.
situations.
Remember too, if you have a large group of adults that's around, that's actually not necessarily protective. So
Hmm.
the studies show that actually, like the more adults that are around, like the worse it is in terms of your chance of drowning for a child. So more importantly than just having a huge number of adults and feeling really comfy that probably someone has eyes on, what you want to do is designate somebody to be the watcher
Yep.
for that time period. That person shouldn't be drinking, that person shouldn't be under the influence of any other substances. We want to make sure that there's someone who is designated.
Hmm.
I will attest from my own patients. I know you see this over and over and over again that, like you said, it just takes a second and you just have to have eyes off for a moment for it to cause irreparable damage. So
Hmm.
we don't want that to be happening. All right. What about first aid? What are things, okay, two questions. What are things, A, that you wish that all parents knew about first aid or first responses to their kids? What things do you think they need to know from an educational standpoint? But then B, what things do they need to have on hand? Like if you had a wish list of 3 or 4 or 5 things that they would all have on hand, what would they be? That would maybe avoid them having to come to us, to me, and a primary care office, or even have to call Blueberry, or definitely to have to be able to go to the emergency room.
Hmm. I mean, if every parent had access to just like a basic first aid course,
Mm-hmm.
that would be so ideal. And like of course there are so many barriers to that, financial barriers, geographical barriers. But if every parent had access to a first aid course just for basic things like choking and bleeding and those sorts of things, like that
Mm-hmm.
would be ideal. And so for me, like from a first aid standpoint at home, like the biggest concern that I have as a parent, and even just as someone who works in this space, like truly is the choking piece of it, because
Mm-hmm.
there's so many things around the house, whether it's food or items or toys that can be choking hazards. And so just being very aware of that, being very diligent about like what kind of food you're presenting, how you're preparing it, like the common ones like grapes and hot dogs, like how you're
Mm-hmm.
cutting them and preparing them, always having someone around when your kids are eating, are for me are like very important kind of prevention pieces. And then even if you can't take a first aid course, just understanding, even talking to your primary care provider about like, what do you do if your child is choking? How do you do those back blows? What is the sequence of that? And what are the appropriate steps to do that? So knowing how to manage a choking event. And then in terms of like what I wish every household had in terms of kind of first aid items. I mean, this sounds pretty simple, like even just some gauze, because one of the things that like when it comes to bleeding, we know no matter where the bleeding is, if you can apply direct pressure to it, that's going to be the most effective way to stop bleeding. So the education around that, I guess. And then even just having like those tools accessible, having a thermometer that works accurately.
Yes.
Right. Having an accurate thermometer at home. I mean, I have a few posts on this, like what the best thermometers are in different circumstances. I'm sure you guys do as well. Like just so knowing what the best thermometer is for your age group, like for the age group of your child, and having that on hand, having antipyretics on hand as well. So whether that's ibuprofen or acetaminophen, both are safe in kids. As long as there are no allergies or other contraindications, of course, but having access to those on hand all the time, whether it's for pain or for a fever, that definitely needs to be on the list too. And then especially if you have like an infant who's younger, where like respiratory illnesses can really get them like snotty and having breathing difficulties, having a nasal aspirator and some saline drops, like that will go a long way as well, just to help with comfort of your child, feeding of your child, and hopefully preventing an ER visit too.
Yeah, for sure. Okay, so a couple hot tips on this. Healthychildren.org, which is the American Academy of Pediatrics website, reputable site. They have an entire page that lists out what are the doses for ibuprofen and for Tylenol or acetaminophen. So you can look on there for your child's weight. It's also a good idea to know what your child's weight is, so that if you are talking to someone at Blueberry, or you're talking to someone at urgent care or on the phone, or even as you're trying to get to the emergency room, if you're going there, that you know what you're going to be dosing, because it's all based off weight for those medications. And then same thing, they actually have an entire page or set of pages that's designated for talking about car seat safety. And so it'll tell you those exact ages and weights and heights and all that stuff, because it's hard for even healthcare providers to memorize all that stuff. So
like I have to look it up every time too. Like when my child graduates to the next thing, I always have to look it up.
Exactly. So, get a screenshot of that or save it in your files on your phone, maybe as emergency, emergency resources. So that way you have it and you're prepared. And then for the thermometer you're mentioning, we actually do a thermometer as part of the kit that people get for their membership. So that's kind of awesome because, as you said, that is one of the hugest things is they're like, you have a fever. I'm like, wait, hold on. Is it 100.4 or higher? Well, I don't know. They felt really hot. Okay, hold up. We got to figure out like what is the actual temperature here.
And how did you measure it? Like if it's one of those forehead guns that like don't touch anything, like we know how inaccurate those are, and how there's so many different things that can affect the accuracy of the temperature with those. So like what is the temperature and how did you measure it?
Yeah, for sure. All right. Okay. So we're getting into the school year. Things are going to shift a little bit. I'm assuming that in your world, just like mine, that the things you're seeing more in the summer are like the swimming. We see a ton of sunburn injuries, lots of things that are from like people's bikes, that type of stuff. Tell me what you start to see in terms of emergency room visits as you get into the school year. Does it shift for you?
It does. So as soon as we start getting into like the school year for one, but then as we shift like farther into fall and winter, like that's when that respiratory virus season really kicks in, right? So, RSV and influenza, and then all of the other kind of the dozens of other respiratory viruses where kids are back in school, sharing germs with each other, in close contact with each other. COVID's going to be on there, I'm sure, this season as well, right? So like all of these things where respiratory viruses are going to go back and forth. Hand, foot, and mouth is, kind of starts to peak in the late summer and fall, and we're right into there right now. And so I suspect that we will continue to see people come in with, or parents concerned about symptoms of that. Another thing, that we recently dealt with in my household because my kid's in out of school care is lice as the school year starts. Yeah. So like, I mean, again, just like, and I want to reiterate this, like has nothing to do with hygiene at all. So much more common in kids because they're just touching heads all the time, right? And they're in close contact, they're reading together, they're playing in forts together, doing all these things together, where that's like another thing that tends to spike at the beginning of the school year too.
Yeah, for sure. In terms of the illnesses, huge plug. Again, we did this a second ago in terms of vaccine preventable illnesses, but there's always a new flu shot every year. So both of us recommend getting flu shots. And then there will be a new recommendation for a COVID shot for this year as well, for 2024, 2025. Not available yet, but it'll be coming soon. So be on the lookout for that as well from your pediatrician offices, your primary care office, because we want to make sure that we're doing as much as we can to lay a foundation of prevention. And then the other thing, people, when they're in close quarters with each other, this is why we see more respiratory illnesses in addition to just the seasonality of different viruses. They are in close quarters, and so they are sharing more germs, especially the little kiddos. So teaching your kids to do the vampire cough and the vampire sneeze, where they are sneezing into the pocket of their arm, coughing into the back of their arm, and then hand washing.
Oh my goodness, yes,
please.
Hand washing.
Please.
When my kids get home every day, the routine is like, ever since the pandemic, you come home, the sink is by the door.
Yeah.
Like when we come in the back door and you wash your hands. And like for every single time they like roll their eyes and get in there. I'm like, guys, we've been doing this for 3 years or 4 years. What? This is not a new routine. I'm like, why is this still such a shock to you that we walk in the door and wash our hands?
Yeah, exactly. So just know part of it when you feel like your kids are getting sick all the time is just because they're getting exposed to more germs. Viruses are part of strengthening our immune system. We know that during the pandemic, we saw because of that isolation that kids after the pandemic, it was like, whoa, the colds are so much more severe. Whoa, we're getting viruses at different times than we normally do just because our immune systems had to catch up. And it's not a bad thing for kids to get a few little viruses here and there, strengthen their immune systems. But the more hand washing you can do, the better, making sure they get their shots. And then also doing things. I know this always feels like we should just kind of, these are throwaways, but making sure your kids get enough rest, making sure your kids get some outdoor activity, making sure that they get good, nutritious foods with lots of different minerals and vitamins in them. All of those things are also really important for strengthening their immune system.
Absolutely.
Yeah. Is there anything that, for your own kids that they've had to go to the emergency room for?
Yes. So you mentioned that one of your kids put something in their nose.
Yeah.
The day before we left on an international trip, I found, those melty beads?
Yeah.
Where you put them
the
on
iron?
Yes, with the iron. So he was 4 at the time, and I found a melty bead in his ear, and I couldn't get it out at home. So literally the night before we were leaving for spring break, I had to take him to the emerge that I work at. And he actually had to be sedated to get it out because it was so far in there that they couldn't get it out. So yeah, it got out no problem. After he was sedated, it was fine and it came out. But so that, and then a couple of times actually. So both of my kids, kind of right at the beginning of influenza season, before the flu shots were readily available, they both actually got flu A and influenza A and got secondary pneumonias from it. And so for me, it really just reiterated how dangerous influenza A can be and how important the vaccination is. And so both of them have had secondary pneumonia, secondary to flu A. But before the time that they were able to get vaccinated in that season. So yeah,
absolutely. Okay. So one other thing that I wanted to mention before we close is just, using the triage nurse at your primary care office, using services like Blueberry that can help to walk you through, do you need to go to the emergency room or not? Because I'm sure you see in your world, just like me, that utilization of emergency rooms, obviously it drives up costs for the entire public. And that even though you guys are amazing at what you do, that sometimes, again, if you're busy with a car accident or you're busy with somebody else, someone's going to be sitting there for a very, very long time waiting for something that in the end, they might be like, oh, shoot, I could have just gone to my regular doctor for that.
Yeah.
Do you see that all the time?
Very often. Yes, very often. And so, there are a lot, I think the health literacy piece comes into that as well, to help understand the best way to navigate the healthcare system. Navigating the healthcare system is a really, really challenging thing at times. And I have a lot of sympathy for patients that are trying to figure out, where should I go? Who should I call? What should I do? I mean, if you truly think it's an emergency, like, yes, please come in. If there are any, like, if you're not sure, there are lots of services that you can use. Like for us, in Canada, there's a service called HealthLink where you
Mhm.
can call, and there's a triage nurse that will listen to the story and decide, can you wait to see your primary care provider? What can you do at home?
Yeah.
And or there's like a virtual service attached, a virtual physician service attached to that as well,
Yeah.
or go to the ER, right? And so there are lots of different options to help decrease ER utilization, including virtual services, including most people don't know, but like their primary care providers often have emergency appointments in the
Yeah.
day, right? So like
Oh yeah.
trying to call in the morning
Yeah.
to see if there are any either cancellations or emergency slots that are available, like that is often an option as well. Having a good sense of where your urgent cares are too.
Yeah.
Yeah.
Awesome. All right. And then last question, I want to know, what is your most popular educational video so that people can go look for it, and also so that we'll go.
So the most popular one is actually a general one, not a pediatric one. It's how to set an emergency contact in your phone.
Ooh.
Yeah. So actually, and the reason I made the video was because of a pediatric patient. So
Okay.
we had like, it was like a teenager who would have had a phone where we couldn't, like, they were unconscious and we couldn't talk to them. And so we're like looking at their phone to try to like see like, how can we find this person's parents to like
Yeah.
get them to come here. And so like that prompted me to make this video of like how to put an emergency contact in your phone where you can access that without your phone needing to be unlocked. So that is like my most popular video by far. I would say that any sort of video I make on pediatric fevers, super, super popular, because it is a topic that people want to know about and want to learn more information about. And I think that there is, a health literacy gap there for sure.
Yeah, for sure. And if your kids do have smart devices that they're walking around with as they're walking home from school, or if they have a smart watch, that type of thing, those are places where you can also learn to put in emergency contacts, where you can learn to teach them to call 911 if they need to. So those are always great ways to use technology. We always think about technology, I think, sometimes as like, an angel and a devil at the same time. But that's one amazing way for them to have more agency over their health. And I certainly feel more comfortable when my kids are walking home, by themselves or with a group of friends or that type of thing, if there's any injuries that are
for sure
going to happen. Yeah. Awesome. Thank you so much for being here. And please tell people where they can find out more about you and your videos.
So I am on all platforms with the handle Dr. Shazma Mithani. Doctor is DR. And yeah, you can find me on Instagram, TikTok, Facebook. Yeah, all the places. Handle's the same.
Okay. Awesome. Thank you so much for being here.
Thank you so much for having me.